essentially they had biodistribution studies done on animals with a vaccine, or with a vaccine that had many of the properties of the RNA vaccine that was ultimately used in humans. But those sorts of studies weren't done in human beings before the vaccines were approved. We have been super busy when it comes to investigating the vaccines and the origins of COVID and basically the government misconduct as it relates to the handling of the COVID epidemic or pandemic or whatever the technical term is for it. And we asked a very simple question of the FDA. We said to them, give us documents about biodistribution studies related to the COVID vaccines. I'm going to quote what we asked for. We issued a FOIA request. We wanted access to biodistribution studies and related data for the Pfizer, Moderna, and Johnson & Johnson vaccines used to treat and or prevent SARS-CoV-2 and or COVID-19. Pretty simple stuff. And of course, we got the proverbial hand to the face, so we had to sue in federal court. Now, what is biodistribution? Biodistribution is a method of tracking where compounds of interest travel in an experimental animal or human subject. In other words, where does the medicine go in the body? And there's been great controversy about the vaccines and where the medicine from the vaccines or where the vaccine material went in the body. And was it limited in one area of the body, or was there a broader biodistribution throughout the body? Well, we got documents suggesting that there was a broader distribution in the body than I think had generally been known. It shows, according to the documents that we uncovered as a result of our lawsuits, that a key component of the vaccines developed by Pfizer BioNTech, which are called lipid nanoparticles, were found outside the injection site, mainly the liver, adrenal glands, spleen, and ovaries of test animals 8 to 48 hours after injection. Now, what that means is that the lipid nanoparticles are the vehicle to get the vaccine to places where they're trying to get it. Now, I thought we had been told that essentially that stuff was all stopped at your lymph nodes under your arm. Well, it turns out this material was in other parts of the body. And the records also show that the Johnson & Johnson vaccine, as part of its submission to the FDA approval, did not include studies of the spike protein encoded in the J&J vaccine. So, I mean, I don't know about you, but I'm not reassured by the nature of the studies that were or were not done here. The Pfizer records include a report which was approved in February 2021 on the animal trials on the distribution of the Pfizer COVID vaccine in rat subjects in a section titled Safety Pharmacology. No safety pharmacology studies were conducted, as they are not considered necessary for the development of vaccines according to the WHO guideline. I know some people who might disagree with whether that's appropriate or not. Similarly, under pharmacodynamic drug interactions, non-clinical studies evaluating pharmacodynamic drug interactions with the vaccine, essentially, were not conducted, as they generally not considered necessary to support development and licensure of vaccine products for infectious diseases. So that's what it says. So you can judge whether you're comfortable with that. The Pfizer report notes that when lipid nanoparticles with a comparable composition to that used in the COVID vaccine were injected into rats, total recovery, percentage of injected dose of LNP, which are the lipid nanoparticles, outside the injection site was greatest in the liver and was much less in the spleen, adrenal glands, and ovaries. So this material was in the ovaries. In summary, also, the LNP distributes to the liver. Same with Johnson & Johnson. Later, let me see that a little bit later down here. It's even worse for Johnson & Johnson in some ways, or the numbers are interesting So, and the Johnson & Johnson records include a 2007 study of the biodistribution of intramuscular administered adenovirus-based viral vaccine using New Zealand white rabbits, which showed that the vaccine accumulated in the spleen, iliac lymph node, and the muscle at the site of injection. A biodistribution table, though, included as an appendix, showed that after the vaccine DNA particle showed that the vaccine DNA particles were still present in the lymph nodes 91 days after injection. And again, the report notes that the metabolism, excretion, and pharmacokinetic interactions with other drugs were not studied in this trial because, quote, they are not applicable to vaccines. So essentially, they had biodistribution studies done on animals with a vaccine, or with a vaccine that had many of the properties of the RNA vaccine that was ultimately used in humans. But those sorts of studies weren't done in human beings before the vaccines were approved. You would think that'd get more attention in the news media, but it doesn't, because there's this pro-vaccine fanaticism in the news media enforced by big tech and the government that even quoting documents gets you censored. So I wouldn't be surprised if this video gets censored because I'm quoting documents, right? Giving my colleagues another heart attack because we've been censored so much as it is recently. These documents show why many Americans have concerns about whether the novel COVID vaccines that were developed at such an accelerated pace were tested properly and thoroughly. So look at the documents yourselves. They're really incredible. They deserve a lot of attention. And I'm concerned that there's safety issues being raised by the testing documents that we've uncovered. Thanks for watching. Don't forget to hit that subscribe button and like our video down below.